Hello, my name is Joe Samona. I am a third-year dental student at the University of Michigan. Let me tell you a little about myself. I was born profoundly deaf. I have four older sisters, and one of them is also deaf. I grew up learning how to talk and lip read. I was placed in an oral program in elementary school. Then, I transferred to a different public school district from middle school to the end of high school and was mainstreamed with other hearing students. Growing up, my favorite subjects were math and science. I always wanted to be an engineer, but that changed when I went to my dentist office in my senior year of high school. At my dentist office, I was laying down on the chair, and when my dentist came up to me, it was like a light bulb appeared in my head. That was when I decided dentistry was a career for me. Because I grew up lip reading and I was always fascinated with teeth, I noticed several behaviors when I was lip reading. Some people were shy to show their smiles, while others were confident to show their smiles. People that are shy to show their smiles are not satisfied with their appearance. I wanted to help with that and build their confidence. Now, I will talk about my journey and about how I got into dental school. After graduating high school, I went to the University of Detroit Mercy and majored in biology. This was the first time I finally understood in a classroom because I finally had an interpreter provided for me. During my time there, I worked and studied really hard to get good grades. Then I took my dental admissions test that is required before getting accepted to dental school, and I did well. I then applied to several dental schools and got several interviews. Now, I had to wait for December 1st because that was the day when I would know if I was accepted into a dental school. Finally, December 1st came and I had been waiting. Finally, I had some phone calls and emails saying that I got accepted into dental school. I was thrilled and so excited that I was accepted into dental school. I had reached my dreams of becoming a dentist after my hard work. I decided to attend University of Michigan School of Dentistry. I wanted to make this video because I grew up knowing nothing about oral health since no resources were available. This made it difficult for me to access oral health care due to language barriers. I wanted to make this video to help improve access to oral health care, and I hope this video will help educate you about oral health. When we are born, we do not have any teeth to perform our everyday functions such as talking or chewing. When we are about 6 months old, we start to have our first baby teeth. By the age of 3, we have 20 baby teeth, also known as primary teeth. When we are about age of 6, our first baby tooth will come out. And at the same time, our first permanent teeth will erupt. At the age of 13, we have all 28 permanent teeth erupted. Finally, at about age 18, we will have 4 wisdom teeth erupted. The grand total is 32 permanent teeth. I will show you a video of the eruption sequence of primary teeth and permanent teeth. Now let's go inside. Inside that tiny tooth, where amazing things happen. The white part of the teeth we can see inside our mouths is called the crown. Not the crown we wear on our head. This is the crown. Below the crown is the root. The root is embedded in the jawbone. The jawbone helps support a tooth. The fun starts now. I will grab an axe. I will split the tooth in half. Our teeth are made of 4 tissues. The white outer hard layer of the crown is called the enamel. The hard outer layer of the roof is called the cementum. Underneath the enamel and the cementum there is dentin. As shown in this picture, the gray color is the dentin. Underneath the dentin is the pulp. As shown in this picture, the yellow color is the pulp. The pulp has blood vessels and nerves inside. Around the tooth and the bone we have a soft tissue called the gingiva, also known as gums. The gingiva helps support and protect the root and the bone. Our teeth have many different anatomical types. First, we have the incisors. There are 4 upper front and 4 lower front, 8 total. We have different types of incisors, central and lateral. We have 4 central incisors, 2 in the top and 2 in the bottom. We have 4 lateral incisors, 2 on the top and 2 on the bottom. These incisors are shaped like a chisel. Their function is to help cut and chop on the food. Rabbits have 2 big incisors, also known as buck teeth. They can chop on hard foods such as carrots. Next we have the canines. 2 canines on the upper and 2 on the lower. Canines are pointy and sharp, and it allows us to tear down tough food. Lions also have sharp and long canines. They will hunt for prey and use their canines to tear down the meat. Next, we have the premolars. We have 4 on the upper and 4 on the lower, 2 on each side, for a total of 8. Their function is to crush down the food. Next, we have the molars. We have 6 on the upper and 6 on the lower, 3 on each side, total of 12. Their function is to grind down the food for digestion. Now let's talk about plaque. Wow, thank you, I'm honored. Not this, another definition of plaque. How many of you forgot to brush your teeth last night and woke up in the morning with bad breath and sticky teeth? That is because of plaque forming inside our mouths. Plaque is a sticky, clear film that forms on our teeth all day and night. Plaque is composed of bacteria, sugar from food, and our saliva. Plaque can be removed easily by toothbrushing and flossing every day. Now we will learn about the periodontium. There are three parts: alveolar bone, cementum, and the periodontal ligament, PDL. The PDL attaches to the alveolar bone to the cementum and helps to stabilize the tooth. Now I will talk about healthy periodontium. There is typically good bone level, if you don't maintain good oral hygiene, then you will have a lot of plaque which irritates the gums. This can lead to inflammation of the gums. Over time, without proper oral hygiene, the plaque will harden into hard white calculus. Calculus can be removed by professional cleaning by the dentist. The inflammation of the gums is called gingivitis. Prolonged poor oral hygiene and irritation by calculus can lead to bone loss, causing teeth to be loose. The loss of bone with the inflammation of the gums is called periodontitis. If left untreated, these teeth can fall out due to not enough bone. Sometimes, when we eat a lot of sugars and carbs, bacteria use these foods to make acids that will attack your teeth. We start to lose the minerals from our teeth that help keep them strong. This graph shows acidity in our mouth when drinking fast versus sipping all day. When drinking sugary drinks, the pH of our mouth drops to a pH 5 to 6, which is very acidic. Our mouth makes saliva, which is very basic. That's a higher pH. The saliva will help neutralize the acidic pop. When you drink it fast, it will give enough time for saliva to clean. If you sip on it all day, our mouths have to make more saliva all day. And there is not enough saliva to clean it all day long. The first sign of cavities is called a white spot. It looks very chalky white. It indicates that the tooth decay is coming. A white spot lesion is a result of loss of minerals. These minerals help protect the teeth against acids produced by bacteria. If you are still eating sugary foods and carbohydrates, the white spot will become a small cavitated lesion which looks like a hole. Sometimes, due to poor oral hygiene and diet over time, the decay can get larger and larger and become deep. The decay can go through the enamel, dentin, and the pulp. The pulp contains nerves and blood vessels. When the decay gets to the pulp, the tooth nerve may die. You can treat this by doing a root canal to help clean out the pulp to make sure there is no infection. Now, how can we prevent gum disease and cavities? Good oral hygiene and diet. Good oral hygiene means brushing your teeth in the morning and at night every day for 2 minutes, and flossing every day. Brushing with fluoride toothpaste is a good idea. Fluoride helps strengthen your teeth and be more resistant to acids made by bacteria. It helps reduce the chance of getting cavities. Now I will show you how to brush effectively. I recommend starting from the outside surface first. Brush your teeth with a toothbrush at a 45-degree angle toward the gums. Brush in a small circular motion, not in a large circular motion. Try to touch the gum line with your toothbrush. Start from the upper right to left, then to lower left to lower right. Next, we will brush the inside surfaces near the tongue. Same idea with the outside surfaces. Start from upper left to right, then to lower left to right. Next, we will brush the chewing surfaces. Same idea when brushing. You can also brush your tongue to get rid of the bad breath. Brush your tongue in a back and forth motion. I have some other tips for you when brushing your teeth. Do not brush your teeth aggressively. Be gentle like you're massaging your gums. It is important to reach your very back tooth. Many people tend to miss these areas. Now I will show you a video of how to brush. floss. Now, for real, I will teach you how to floss. Grab about 18 inches of floss, curve the floss into a C shape, slide it up and down along the side of each tooth. Do not slide it back and forth. Do not forget to floss the back sides of your back teeth. Now I will show you a video of how to floss. Let's talk how to eat and drink to keep your teeth healthy. Sugary drinks and snacks do the most damage to your teeth. Regular foods like lunch and dinner, and even desserts, not so much. Ideally, we should only eat foods, snacks, and drinks that contain little to no sugar. No candy, potato chips, or cookies. We should eat only fruits and vegetables and drink water. Let's be real, not even dentists do this. I have some ideas for you to keep your teeth healthy. If you drink pop, of course, water is the best for your teeth. Try sugar-free pop or diet pop. Consider drinking soda in big gulps instead of sipping, because pop can be acidic. When you sip, the pop will be in your mouth a lot longer. Your enamel will lose minerals and become weaker. Consider using a straw to bypass the teeth. Consider also having a bottle of water so you can swish and swallow occasionally to rinse the sugar off the teeth. Beware that fruit juice, like apple juice and orange juice, and many sports drinks have a lot of sugar. If you like snacks or candies, it's okay to eat candy and junk food once in a while. Everybody does that. See if you can eat more things that are low in sugar. Instead of chips, eat popcorn, nuts, and pretzels. Snack on a power bar instead of a candy bar. Enjoy chocolate? Go for the dark stuff instead of milk chocolate. Cheese sticks and apples are good snacks because they are easy to carry and easy to munch on. A bowl of regular Cheerios with or without milk is a great low-sugar snack. After eating cake, cookies, and other sweet foods, swish and swallow with diet soda or water. Just try a couple of these ideas and your teeth will thank you. Growing up surrounded by hearing strangers, students, faculty, I was judged by others that I would not be successful. I struggled trying to learn in school while lip reading my teachers. My struggles pushed me to work harder, instilling in me the motivation to work hard with the mindset that I can achieve anything. I grew up with limited knowledge in oral health and found how it is difficult to communicate with dentists due to lack of interpreters and masks covering their faces. Other deaf people have told me they experienced the same thing I was feeling. I hope that by becoming a dentist, I could provide access and break down these communication barriers for my deaf community. I hope to be a leader for my deaf community. I shadowed other dentists and got involved with the pre-dental programs at my college. After these experiences, I saw that dentists are making the difference in their community by helping others. My experience in community service has impacted me greatly and led me to choose a career in dentistry. It helped me understand the importance of serving others because I felt like I can make a difference in the deaf community. When I first started my dental education at U of M Dental School, I was nervous because I am the only deaf student in my program and that I would not be able to make friends. I was welcomed by all of the faculty and my classmates, and they were very supportive of me. Dental school is very challenging, but that does not affect me because I love learning many new things about dentistry. I love being able to work with my hands and use my hands to serve my patients and increase the deaf awareness at U of M. As I walk around the dental school as a deaf dental student, I have raised the awareness about the deaf people and the language. My classmates have realized the challenges that I had to face, but I approached it with a positive attitude. I am glad that I chose to attend the University of Michigan Dental School because of many reasons. I get to attend the top dental school in the nation, and I am receiving superior education. Go Blue! I love the diverse community here at University of Michigan and being welcomed by others. I've received so many opportunities that I thought it would be out of my reach. How do you become a dentist? First, you need to enroll in college and take prerequisite classes such as biology, chemistry, physics, and other classes. You need to work hard to get good grades and be prepared to take your dental admission tests. Once you have these done, you can apply to dental school for acceptance. Dental school is a 4-year doctorate program that runs all year round. I use a captioning service for lecture classes and interpreters during clinics when I talk to my patients. When I see the patients for the first time, I will simply introduce myself with a friendly smile and explain to the patient that I am deaf and I use a sign language interpreter. I have struggled communicating with my patients and faculty because of my interpreters. Since the terminology in dental school is very complicated, it can be difficult to communicate through sign language. I've had to educate each interpreter regarding dental education and have developed many signs to be able to effectively communicate. As a dentist, what can I do? Well, many things. I can clean your teeth, remove the decay and put in fillings, improve your appearance and smile, remove teeth, and make replacements for missing teeth. In addition to being a dentist, You might consider a career as a dental hygienist, which is a bachelor degree. You can be a dental hygienist in 4 years after you graduate from high school. A dental hygienist can work for a dentist and they help take x-rays, clean teeth, and educate patients about oral health care. If you are interested in learning more about a career in dentistry, you can email me at joesamone@umich.edu. That's JOESAMON at umich.edu.